Welcome to our Living Well with and Beyond Cancer Conference 2020. My name is Dr. Eddie Murphy and I'm going to be your MC over the next 2 days. This is a unique conference because we're going to meet in a virtual space, first time ever. And the Irish Cancer Society are here. They've got lots of information and support to support you, whether after a diagnosis or going through a diagnosis. It goes without saying that this year is unique because of COVID-19. And it's brought incredible uncertainty into our lives. On top of the diagnosis and living with cancer, and I know this because in our house we have a shared experience, my wife is going through this journey as well, that there's isolation and cocooning and all the anxiety that brings. The key point is that we're apart, but we're not alone. We can put our masks away today. In the comfort of your own home, these masks that have been traveling around with us for the last number of months, we can put them aside, we can have a nice, comfortable glass of water, a cup of coffee, relax into our conference. And remember, the Irish Cancer Society is information and supports for you. It has a free phone support line, 1-800-200-700, and cancer.ie is the website where you get all really good quality, evidence-based information that you need. So let's explain what's going to go on here. There are 4 areas that are going to we can navigate. We have the stage, we have the sessions, we have networking and expo. And I'm going to tell you all about these. And my job is to help you get into the place so you can find what you want to listen to and find we have some incredible speakers. On the stage, I'll be here twice a day. Shortly, I'm going to be joined by Robert O'Connor discussing living with cancer during COVID. In the afternoon at 2 o'clock, my colleague Dr. Paul Dalton will be discussing about managing fear and overcoming fear. The little red live icon on the left will let you know when we're on the main stage. The next one is the sessions. This is where the workshops are. Now this is incredible. Imagine all these workshops. We have mindfulness, fatigue management, looking at childhood cancer, advances in treatment, living with lymphedema, lots of things. And the beauty of this is they're all recorded. And if you're like me, when I go to a conference, I always go, what workshop do I want to go to? I go to this one, this one, this one. But hey, they're all recorded. So you can go back and look at them. This is incredible. It's the power of technology. In our next section, it's the networking. It's about the importance of sharing stories and connecting with others that are going through similar experiences. In the networking session, you can start a conversation in the main event chat. You can put in messages to us. You can visit the networking tab, and it's almost like speed dating. You can pair up with somebody for a short video chat, and you can search people and message friends you mightn't have been in contact with for a while. And finally, the expo area. The expo area is our exhibition hall where you learn about services, products and resources. You click on the exhibition booth and then to learn more about them, how you interact with them during the conference. So remember, Irish cancer nurses, they will be available in the support line booth throughout the conference. Visit the booth to talk live by chat or video call. And remember, if you need technical help at any stage, let us know in the event chat to the right. Thank you so much. Really looking forward over the next 2 days to engagement, to learning, to sharing, to connecting and to supporting. Anyone spot the difference? You can type it in on the chat function between me 5 seconds ago and me now. So if you can figure it out, I want lots of interactivity over the next 2 days. I'm going to be asking you lots of little questions. Really get everybody involved. We want to connect and share. And we're going to talk to Caitriona Plunkett now. Caitriona is a survivor and a thriver. She had a triple negative cancer diagnosis, breast cancer diagnosis in 2016. And Caitriona, welcome. Great to have you on board.
Thank you.
Caitriona, maybe you could tell us a little bit about 2016. You were turning 35 and it just sounds like it's just a horrible year for you, and where you are then and where you are now.
Yeah, back seems like it was a million years ago, and yet it feels like it was only yesterday. I was diagnosed with triple negative breast cancer, and it was a bit of a whirlwind. I as you said, it was literally just at my 35th birthday. I'm happy to report that I've had better birthdays since then. Um, but yes, I had 16 sessions of chemotherapy, and then I had a mastectomy with immediate reconstruction. And I'm now 4 years, nearly 5 next year, since that diagnosis. I am cancer free as well. And I have changed a lot of things. I'm now back at university studying health psychology. And I'm also a very proud volunteer with the peer support with the Irish Cancer Society.
And yes, that peer support worker that you're doing with the Irish Cancer Society is very important. Can you tell us a little bit about your work in that area? I'd be really interested to hear that. And we've up to 1,000 people tuned in here this morning from all parts of the country. And maybe you could start typing in what part of Ireland, or if you're overseas, where you are, and we'll offer Caitriona support as well. So pop that in, and Caitriona, tell us a little bit about that peer support work that you do.
So effectively, it is peer-to-peer support. So, for example, if you have just been diagnosed, been dealt that blow where you've been told that you have cancer, there is a fantastic support where you can contact the nurse line, the number that Eddie has given, or you can email at cancer.ie to contact them. And also, what they do is they listen to what you're going through, and then it's nearly like a matchmaking service, if I can put it that way. So they will try and match you with somebody that you have had a similar experience. So, for example, let's just say me. Let's just say you're a woman in your 30s and 40s. Maybe you have kids like I have, and you've been diagnosed. Maybe you need a mastectomy, and you are just needing to talk to somebody about like reconstruction. So effectively, what it is like you have somebody to talk to. You have that support, and it's not going to be. I'm not going to sit there and judge you. I'm not going to tell you what to do. None of the volunteers. We're not going to do that. But it just allows you that space where maybe you're going through a thought process about trying to decide what type of reconstruction, for example, that you're wanting. Maybe you're looking for that support on how you could tell your kids that you have cancer.
And one of the things there, if I could just say, Caitriona, that one of the things is about when somebody experiences something and they go to a professional, but quite often people want to reach out to somebody that has walked that pathway. It's a very different thing, and that's the unique thing about peer-to-peer support. And I know Cancer has visited our house. I have 2 boys, Oisin and Dara. They're 10 and 12. You have 2 children similar ages. How did you have that conversation? Because I've had to have that conversation too with my boys around my wife's cancer. How did you have that conversation? Because it's a challenging conversation for us to have.
Do you know what? And as you know as well, Eddie, it is probably one of the toughest conversations that you can have, really. So when I was going through it, so they're 13 and 10 now, but they were 9 and 6 at that time. And it was like, what am I going to say? So the first thing that I did was that I read the resources. So my lovely, lovely, amazing breast care nurse in my hospital, she gave me an Irish Cancer Society publication. And it just gave me some little tips on how to talk to my children. And it's all about being age appropriate. And I know we don't want to scare our children. We don't want to upset them. We want to protect them. And sometimes your natural instinct is to not tell them. But the one thing I would say is with children, they're just so clever, aren't they? They're just so smart. They're smarter than us sometimes.
Well, they want to know. They're quite concrete, and they want to know facts as well. And also, the worst thing is about not giving information is then children start adding links in their own head and making up information for the gaps. And I think you're right about that developmental age and getting the information right at whatever age the child is at. In terms of the peer support work, really important work, maybe you could talk to that again to maybe encourage other people to think about doing peer support and where resources they can access peer support. If you're looking in today and you want to find out where you can get peer support, because I think it's really unique form of help. I think it's helping somebody else. It's a very powerful way, and volunteering also shows a lot of massive contribution as well.
You know, it's so important. It's just being able to be there for somebody. Like, I have been through breast cancer, and it's just so wonderful to be able to give back in that sense, to listen and go, yep, absolutely. I know it's a really, really tough road. One thing I would say is that I always, always, always respect that just because I have been through cancer, I absolutely respect that every cancer journey is completely different. But it's just nice to have that commonality to talk about bits and bobs that sometimes you just don't want to have those certain conversations with even close family members. They just want a different perspective. But one thing I would say is that even though I'm giving as a volunteer, I have to say, and this is really, really important, that I have got so much more back out of it. I get so much out of it too.
Well, I believe in quite often. I'm a psychologist, and quite often we're asked what's wrong with people, and but when we start looking at about wellness, and this conference is about living well and being well, and what is living a life of pleasure, meaning, and engagement. And what does that mean, pleasure? So if I had a magic power in me on this beautiful day in Ireland to give everybody a 99 cone, and you can have chocolate sprinkles on it and stuff like that, and I know that oncology dietitians will be aghast at this later on, but it might give you a sense of pleasure. But if I gave you a second one, that pleasure is short lasting. And meaning and engagement is very powerful. It's a dynamo to our well-being. Meaning and engagement. What gives you meaning and engagement? And volunteering, it can be really powerful in giving us meaning and engagement.
Yeah, absolutely. I have to say, I just absolutely love it. And it is an absolute privilege to be able to talk to so many women. I hope some of them are here listening today. And so I would just ask, please do consider taking on such an amazing, amazing role.
And I want to thank you, because I believe that what you've done, you've set this conference up in a wonderful way with your wonderful smile. And what you've done is you've brought hope and light to this conference. And hope and light is what we're going to shine out over the next 2 days. We're going to bring hope and light right through to all our participants. We've an incredible speaker coming up. I want to thank you very much, Caitriona. I really appreciate your volunteering, appreciate your time this morning, and you're going to be in our networking room so people can connect with you. You can find it on one of the sides there. But really, thank you very much, Caitriona.
My pleasure. Enjoy, everybody.
Good morning, everybody. It's a great pleasure to be here as part of the conference, even in these very trying times. Firstly, I want to welcome you. I want to say how much I'm missing meeting you in person, and hopefully we'll all get something out of the next few minutes chatting about COVID and cancer. If we can start up on the first slide. Great. Okay. All right, so I suppose the last few months really have been a huge turmoil in all of our lives. And actually, as I was preparing these slides, I kind of thought really that this year has really been pretty much every Hollywood disaster movie ever, particularly the ones that have focused on infection, and has taken a huge toll on all of us. And I know it's only September, but the only two Hollywood films that I don't seem to have happened. We haven't had an alien invasion yet, and we've dodged a few asteroids. We haven't really had those, but it is only September, I suppose. I make light of it, but in reality, this has been very tough for all of us. And we can't really talk about COVID without talking about that impact as well. So I want to call that out at the start. I think many of us are facing information overload. We see so much on the news and social media, and we've got our own personal issues, and then a cancer diagnosis about that. And I think everybody needs to be aware that everyone is worried. Everybody's uncertain, hurt, lonely, and unsure. And then that cancer diagnosis, as I mentioned. And I think many of us are probably really grieving for what we miss, the things that are important in our lives, our family, our friends, the company of others. But just to point out, and if you take one thing away from this, point out we are getting through this, and COVID will come to an end. There is an end, and we will overcome this. So to start out, and my background is I'm a bit of a lab rat, I think most people would call me, so I have a little bit of a background in some of these areas. So just to explain what we understand about COVID and where did it come from. Coronaviruses, and this is one of a number of different coronaviruses, are quite common in different kinds of animals. And at some stage, probably in the summer or the autumn last year, a coronavirus found in bats probably jumped across into human beings. These people probably had a cough, cold, flu in the early days. At some stage then, probably around November it appears, it got into a big population centre, probably Wuhan in China, which is a major global transport hub. And it spread from there to many different parts of the world. A number of countries started to see unusual levels of flus and unusual flus in mid-December. And by the turn of the new year, the Chinese government had flagged that there was a new virus and also provided the sequence. And I think many of us watched in absolute horror through March as a number of different health systems around the world teetered on the edge of collapse. The main point I want you to get across from today is, I guess, your own risk as somebody impacted by cancer and the impact and the risk for those around you. The severity of the disease is really tied to how old you are, your health, so what other health conditions you might have, and also something that we don't have direct control over ourselves, but is very important around us, and that's the functionality of our overall health system. Children do get infected with this illness, but they don't seem to really show symptoms the same way, and it's rarely serious. One or two exceptions, but it's rarely serious for children. Adults get it, but 4 out of 5, 8 out of 10 adults will either have no symptoms, ranging right up to having a bad flu. But people who are most at risk of this are those who are over 70, and their underlying risk is really associated with their age and other health conditions, and they are at a tremendously higher risk of major illness requiring hospitalization and perhaps even death. And forget about as well is what are called now long or long COVID, and these are people of any age, particularly adults, often younger, where we see high rates of long-term health damage. We don't really know how long that's going to last. So looking at the Irish information, broadly speaking, about 1 in 5, about 20% of people will have no major symptoms. And this is a challenge because those people for maybe a week, 10 days can be infectious. So they can pass on the illness without really knowing that they're sick and without others knowing that they're sick as well. For the other 3 out of 5, 60% of people, they'll show maybe moderate symptoms up to a very severe flu, somewhere in that kind of range. Roughly 1 in 10 are hospitalized, and about 1 in 100 will require critical care, and people do die from this illness. On a positive note, the advances in management and treatment of COVID are leading to less deaths in those more severely ill people. Now that's looking at it kind of from a medical system perspective, but if we take all of the different ages and so on, and some people when they're older don't really get the same level of access to critical care, they may be too unwell to move into a hospital situation. Broadly speaking, the numbers to date in Ireland show that for every 100 people infected, 11 will need to go into hospital, and unfortunately 5 will succumb to their COVID infection. And that's when a hospital system is fully working. This is important because as the numbers go up, if the rates get higher and higher, we can see the mathematics of that relationship. So I've just kind of illustrated this here on the graph, and we can see, I said, those numbers for every 100, 11 hospitalized and 5 will succumb to their illness. But if the infection gets bigger and bigger, we see those numbers correspondingly get bigger as well. And at some stage, our system potentially wouldn't be able to cope because those figures assume a functional health system. And as doctors and nurses maybe become infected, our health system isn't able to deliver the same way. And this is why this flattening the curve concept is so important. And by protecting ourselves from this infection, we are actually also contributing to protecting society. Most people focus on the fatality aspect, but actually this long COVID or these long haulers are an increasingly worrying trend around this illness. Broadly speaking, there's a lot of different data on this, so it's hard to get a specific number. But 1 of 5 of those not hospitalized will develop long-term health implications, and half of those who are hospitalized will have life-impacting health changes. These can be very serious fatigue, damage to the lungs, heart, circulation, kidney and brain. So these are quite serious symptoms as well. What's the worst case scenario? And I suppose we thankfully are well away from this worst case scenario, but in parts of the world, like in Brazil, in the city Manaus, there has been no effective intervention for COVID. That's a very young population there, so 17 out of 18 people there are under 60 years of age, and yet 1 in 350 have succumbed to the illness and have died. And that's obviously having huge impact, even though it's a young population. We're well away from that situation, but this is what we're all striving in all of the different measures that we're all doing as a community to try and prevent. So how's Ireland doing so far? To be fair, we're probably middle of the road, I suppose, is one of the best ways to say it. I've outlined some of the things, and I suppose one of the best ways to make a direct comparison is the death rates in different countries. Some of the Nordic countries are doing well, but Ireland is also doing well and is keeping at around about the European average, maybe a little bit less than the European average. Some of our neighbours and some of the countries that we might look to, though, are not doing so well. For example, the UK, Spain and the USA. And I suppose we're only using the reported data, and there will be a lot of academics will be seriously concerned about the accuracy of some, particularly the US data. And when we look at excess mortality, so the extra number of people who died over previous years, it looks like roughly 1 in 1,000 people in the UK have already succumbed to this, and quite likely a bit over 1 in 1,000 in the US. So these are serious illnesses having a serious impact. So I've taken some of the data from the Irish sources I've just left up there on that preceding slide. And I just want to focus in a little bit on age for a minute. And across the bottom here, we see the different age groups, and the grey bar shows the percentage of those in that age group that are positive. And we can see in those less than 15, the rates are quite low. And then as we go 15 up, right up to into the 50s, we can see there's a reasonably constant level of infection. But as we get older, we see the yellow and the orange bars reflecting those needing to be hospitalized and those needing to go into ICU going up. And then when we get into the 70s, we see this red bar of the fatality rate going up. And we can see it's quite high. Over a third of those 85 and older will succumb and will die from their illness. We're focusing on cancer, and really, I suppose we need to focus on those who particularly have active cancer and potentially other illnesses, because cancer often doesn't occur just on its own. It happens with many other illnesses. So if you have an active cancer, or if you have some of these other health conditions, you're more likely to get COVID, and you're also more likely to become seriously ill. So heart disease, hypertension, diabetes, respiratory disease, etc. And again, the red bars are the percentage of people with those conditions who died from the illness. Just focusing in on cancer for a second there, we can see that many people who had active cancer ended up being hospitalized, about a quarter hospitalized, maybe a quarter in ICU, and unfortunately a little over a quarter have succumbed to their illness. But it's not all bad, and I guess I want to focus on some of the bigger aspects around this. Annually, we have over 23,000 invasive cancer diagnoses, over 44,000 cases of cancer in total. And we've over 200,000 people who've been through a cancer journey. And to date, 850 is the total number in this country who have any aspect of cancer who have tested positive. So the consequences are very serious within our community, but the efforts that we are all making, the cocooning, the PPE, the treatment changes, etc., all of that being done has saved vast numbers of patients, and it has also maintained capacity. So it has meant that we have been able to keep treating cancer right through this. The risk isn't uniform, and I suppose cancer is a tag that's used in a number of different ways. The highest risk are for those who are on active cancer treatment, including people, for example, on stem cell transplants. And they're at very high risk of COVID complications, people with lung cancer, with certain types of blood cancer, certain types of surgery that are high risk as well. Some forms of treatment don't seem to bring a high risk with them. So certain types of immunotherapy, the risk seems to be similar to those at that of people of the same age. Ongoing treatment, certain types of ongoing treatment again will lead to impact on the immune system. So in particular, we see blood cancer patients at higher risk there. Post-treatment and after treatment has been completed, the risk is largely similar to that of the person's underlying health conditions, other health conditions and their age. And we have to remember family members as well, and again, their risk is related to the age and the other health conditions. So the impact, I think, has been, many of us would have seen big changes in treatment, a lot of fear and uncertainty around those changes, and possible future outcome, what might be for our cancer and our cancer treatment. And I suppose we do also worry about the longer term impact for our whole health system around this. Just going to list a few of the things that I suppose we're all aware of. Screening stopped in March, and a limited resumption has taken place. But unfortunately, not everybody who's being invited is actually taking up the opportunity to screen. That's something we need to work on. But we've potentially missed a number of cancers as a result of that screening having to stop. And that needed to stop because screening, it only takes place in healthy people, and we cannot expose healthy people to an undue risk. There's been big changes in GPs, and GP surgeries had to essentially change over essentially a week. Some people unfortunately have been afraid of some of those changes. They've been afraid to speak to their doctor. And we know the numbers are showing that between March and June, far less people check symptoms with their doctor, and less people also presented at hospital. And this will tend to mean that people present later with conditions. And we're not just talking about cancer, we're talking about other conditions, heart disease or whatever. And presenting later reduces chances of a good outcome. So if you have any symptoms, or you know someone who has some of those vague symptoms, they need to have a chat with their GP. Doctor and hospital appointments also change. I suppose one of the biggest impacts was a lot of virtual consults now, so using the phone, using technology, video chats, etc., to try and avoid, and I'll explain this later on, try and avoid that contact risk. Risks in hospitals are potentially high because hospitals have people who are ill. So people and the hospital system, the health system, has been trying to reduce those contacts and change how care has been given. We've seen lots of situations where people are having to wait outside and be called in. In particular, it's very challenging to go into an appointment on your own. We've seen also that doctors are now sending prescriptions to pharmacies, which is actually a good thing. So this has been very unsettling for some. Some patients have gotten angry, and a lot of just fear and uncertainty. But there are some benefits to these aspects as well. We've also seen significant delays in treatments, really around trying to protect and delay the risk that people might have from catching COVID. But this can lead obviously to loneliness, isolation and confusion. On the positive side, we're seeing less hospital-acquired infections, which is a good thing. And cancer patients can get infections not just from COVID, but from lots of other situations. It's much easier to get support. You can just ring your doctor, and it's easy now to just pop in and your prescription is waiting for you in the pharmacy. Can we move on to the next slide? Yeah. So the impacts on treatment. Obviously, doctors have had to try and work with patients and try and balance the risks if they got COVID versus the risks of changing certain types of treatment. Some scans have been delayed or take longer because of all of the preparations and that now. So there's a lot of challenges around delays and that as well, and also some changes to treatment. So some types of surgery have higher risks, where certain types of radiotherapy maybe not has higher risk. And these are all, I suppose, causing challenges, increasing waiting lists, and potentially increasing anxiety and distress. And we do worry that if those delays go on for an extensive period of time, and we're talking many months, that might potentially impact the likelihood of a good outcome. But bear in mind, we have managed to maintain treatment, and patients with advanced cancer have been treated right through COVID. And this is unlike many centres in parts of the developed world where all treatment essentially had to stop. I'm Director of Research, so I have a lot of interest in research, and I know some of you will be on clinical trials and want to be on clinical trials. All academic research stopped for a time, universities shut down, people were seconded and moved off into other things, and recruitment on clinical trials stopped for several months. Some patients would have also seen changes in their treatment. And fundraising for research has been badly hit globally, and this will have knock-on effects if we can't reverse it. But research is taking place in Ireland. It is back operational, and the efforts to improve care and outcome continue, even though they may have been stunted for a few months. Terminal care, perhaps one of the most distressing aspects, and a lot of impact there because of the inability to go and see somebody, to make peace, to hold somebody's hand and to comfort them. We've all seen difficulties with not being able to go and go to a loved one's funeral and challenges around all of that. And I suppose we're trying to ramp up our use of technology to maintain safe levels of contact through all of that. Just to mention, we in the Cancer Society have been working hard to overcome some of these challenges. We've seen a huge increase in our demand for night nursing services, and we're continuing to recruit nurses. A lot of travel difficulties for patients, and we are supported by our volunteers, an army of volunteers who help drive people to their and from their chemotherapy appointments around the country. But people stepped up and we maintained our volunteer driver programme, and we're the only country in the world that managed to do that. Some of our daffodil nurses went into direct care in hospitals. We've seen a lot of rejigging of our systems to be able to provide care and provide psychological support, counselling and psychiatric services remotely right across the country. Research was curbed for a while but is back operational now. And I suppose we've been working a lot on advocacy as well to make sure that as a nation we don't forget about cancer, and we do not want cancer to be the forgotten sea. We've also been providing a lot of information on our website, various podcasts and videos, and I invite you to go onto our website if you want to see some of those and learn some of the things. So I'm going to finish up by what we need to know about COVID and try and condense all of that down. COVID is transmitted on particles. This image here kind of shows particles that spray out. In this case, this person is sneezing. Coughing can spray those out, but also any sort of exertion that forces air through our lungs. So things like singing, strong exercise, etc., will force these particles out at a higher rate than just normal breathing. But even breathing very close to somebody or being close to somebody who is breathing runs a risk if they are currently infected that they could pass the infection on. So the most risk, and what we have to absolutely focus on, is not breathing in those particles. Hand washing is important. It protects against lots of different bugs, but COVID mainly gets in through those droplets. Cancer patients need to remember as well that we don't just worry about COVID. So while there's a lot of increased risk of COVID, there's increased risk of lots of different infections and the severity of those infections. So other things like flus, food poisoning, diarrheas, etc. But also some of the bugs that live normally in our body can overgrow and cause infection as well. So anybody who gets a high temperature or other signs of infection really needs to get that checked out with a doctor, because it's quite likely not to be COVID. It could be other infections. So these need urgent care, and you need to get in contact with your doctor. Some of the other problems, obviously isolation is a big issue, and I think one of the biggest punishments in a prison is to be in solitary confinement, and I think many of us now understand why that's such a punishment. But isolation protects us, but it can also, when we're isolated, some of those other worries and fears can really build up. And we need to also remember other conditions are not going away: heart disease, high blood pressure, etc. So to take back control and how we protect ourselves, we need to avoid contact situations. That is first and foremost the most important thing that we can do. Minimize the number of contacts where we are in public situations, because each contact brings with them an extra risk. Keeping distance is very important. So those things really, and if we can do those, if we were able to do these with everybody, we would actually stop the infection over a very short period. Indoor is a little bit higher risk than outdoor, because outdoor these droplets can dilute away very quickly. Face coverings are important, but as illustrated in this picture, they have to be worn properly. Just having a face mask is not a protection. Wearing it properly gives protection for those around you and gives some protection for you as well. Cough etiquette: sneezing and coughing into the arm, very important. hand washing, and try not to be unduly worried about some of the other things of life around the post, the food coming in, etc. Some other practical things: quit smoking if you can. Quit.ie is a great source of support and information on that. Vaccinate, because we don't want you getting other illnesses and infections at this time as well. And be proactive on your health. Because there may be delays, you need to get in and report to your doctor where you have worries or concerns about your health. Stay in touch with people. Remember, even the old-fashioned letter. If you're not that techie, people still love to get a letter. Very important to get outside, very important to exercise. But exercise isn't necessarily going to the gym and doing weights. It can be a casual walk with a dog. We go out and do a bit of gardening. Maybe some of us are a little bit overloaded with information, so just be a little bit careful how much we become addicted to that. Maybe just once a day or that. And ask for help. There are so many people out there who are just want to give assistance in that. And we as a nation have done a lot to provide practical and emotional support and make it accessible. Lots of different agencies out there. We have our support line that Eddie mentioned earlier. But even agencies like the Guards, the Post, Remember Alone, there are lots of people out there, so just reach out. If you're sitting there and you're worried about something, reach out. So just some final thoughts to bring this all together. This is tough, this is challenging, but we have all done well as a community, and this will eventually end. We see a number of vaccine candidates in trials, and I suppose we would expect to see some of those get approval probably around spring next year. And they will be gradually rolled out. So we're looking at something that will probably impact us into 2022. But there is an end in sight, and this will come to an end, and we will get to meet up with us all. And we need to mind ourselves and look after each other as best we can. So I'm just going to finish up with a final slide here, just giving you some of those contact points: 1-800-200-700 or cancer.ie, and you'll see a huge array of resources there. Evidence-based resources that around different aspects of COVID. Thanks very much for your time, and look forward to having some questions now with Eddie.
Okay, Dr. Robert O'Connor, Director of Research with the Irish Cancer Society, thank you for such a very informative and bringing us up to speed and decluttering all the fake news that we all hear about now. So we're into the real news and the real world, and I want to thank you. A couple of questions have come through. We're going to start off with a poll though. I'm very interested in your experiences over the last 6 months in the impact of COVID on your stress levels. So we're going to shoot out a poll here. I'm going to ask you if it's very high, moderate, not at all, a little bit, and then just pop in a number there. We really want to get you involved in this Living Well Beyond Cancer 2020 conference, virtual conference. So please indicate your response to that poll question. We really want to get a look at that. Also, we want to thank you for those people in Greystones, Cork, Dublin, Wicklow, Roscommon, all the people that put in where they are from. And because I have Robert here now, I'm going to ask the hard research questions. So if you have questions to ask Robert, get them in fast. So one of the questions I have here is around the whole area of trials. Being on a trial, does that impact in terms of risk and COVID situation?
I suppose a not straight answer. The risk is around your cancer and the impact of the treatment on you, and there are lots of different kinds of trials. So some trials, as I mentioned, some of the agents really have very little impact on our immune system, and some of the other agents maybe will have an impact. So it really depends on what kind of trial you're on, what the medicine or the form of treatment that has been trialed as part of your trial. And really, I'd suggest you have a chat maybe with your doctor. They'll be able to best advise with that, or maybe your trial nurse. They'll be able to give you all of the information. But do bear in mind, everything is being done to protect you from getting infected. The hospitals, they've all moved, they've all reconfigured, so you're at low risk when you're actually in the hospital situation. So maybe just have a chat with your nurse, with your doctor, and they love talking around these things and they want to reassure you.
So that's it. Go back to your prescriber and get talking. I mean, This is all about talking today, and you can go into many different sites. You can go into our networking section. You can go into look for support with our wonderful nurse care team in the. So try and get some. But the question I have is around around flu vaccines, and maybe you could talk to us where we're at with flu vaccine, the importance of it, particularly in the context of COVID and cancer.
Sure. So flu vaccination is starting now, and people who are at high risk, which will pretty much include most people I think in the audience here, will get the flu vaccine for free. So they can pop along to their GP, their pharmacy, they'll be able to provide it. I would recommend that you go early. The reason being that we're a bit worried about the levels of vaccine that are available. There are some shortages, so it would be a good idea to do that early. The vaccine is a good idea because while the measures are in place will probably reduce the impact of flu, we need to make sure that no one gets an avoidable infection, because we won't know if it's COVID straight away. So if somebody starts getting a bad cough or whatever, and we don't need flu on top of this COVID illness, we really don't. So by getting vaccinated, you're protecting your own health, but you're also protecting the health of everybody around you. So it's a great community thing as well as something of personal value.
So really important message there, early intervention, early treatment, get out there and you'll be first in the queue. You've heard it here from Robert, the Director of Research in the Irish Cancer Society. Let's get out there and just to say that I do get flu vaccination every year. Lead by example, and I want you to do the same.
And it's not just flu, Eddie. There are other vaccines, and in particular pneumococcal, and patients and people been treated for cancer are at risk of getting these infections that can cause pneumonias or blood infections and that. So talk to your doctor. They'll be best able to advise. And a lot of what I'll say is really going back, the person who knows your health best is your GP.
Okay, so super advice there. One of the questions I want to ask is around the uncertainty. COVID has brought a lot of uncertainty for us and for many people, and uncertainty has created a lot of levels of stress and worry, concern and anxiety for different people. Maybe you could speak to that a little bit, Robert.
I suspect, Eddie, your background, you'd know a bit more about that, but I guess we know, and some of the monitoring that's going on in the background is actually measuring this at a population level. So we know that this is kind of going up and down. We know that it's higher amongst people who are impacted by serious diseases as well, because at the best of times, they have those concerns and those worries, and the illness itself can be quite isolating. So we know that these are challenges, and that's why we in the Irish Cancer Society have invested so much to be able to provide supports through our support line, 1-800-200-700, and that can link you into lots of different supports. So yes, there are challenges there. We know that there are going to be challenges going forward, because today, bear in mind, more than 100 people will get a cancer diagnosis. So these things are ongoing in the background. Big challenge, and it is one of the issues with these, and we have to find within ourselves that resilience, and human beings are hugely resilient. So it's okay to say I'm having a difficult time, but we are still able to get through. We've had this before. Human beings have survived many different pandemics over the centuries, and we will get through this as well. So maybe if that gives a little bit of hope to people out there, and maybe we need to focus a little bit more on some of the hopeful and positive things while being cognizant and protecting ourselves as well.
Some great advice there. And one of the pieces I would like to maybe just speak to there is quite often people are worried and anxious. And one of the things I picked up from your slides is people are scanning the news, scanning the daily numbers, scanning and scanning. And one of the quickest wins to our wellness is around our sleep and having good quality sleep. And I believe that if you are going to dip into scanning is an anxiety behaviour, so I'd encourage you to do it just once a day if that's what you need to do, even less, because if something happens in this COVID world, believe me, you will hear about it, and maybe earlier in the day so that it's not impacting on your sleep. One of the questions that come through here from one of our attendees is with family members working and in college and they're at school age, is removing their external clothes on return from work or school. Is that sufficient in terms of good practice, or is there something else that person should be doing in that house? So obviously a concern.
Yeah, I guess we need to try and work through where the risk is, and the risk is really from contact with people. We haven't really seen any evidence of the infection passing on through people's clothes and that sort of thing. So it doesn't seem to be a major factor in this illness. It really is people coming into contact with other people. So if that gives somebody comfort, fair enough. But I wouldn't focus too much on that. It really is, as I say, around stopping coming into contact with people who might be potentially spewing out some of those particles.
So it sounds like that person's doing enough. If someone's changing their clothes and showering, there's a good level of reassurance that you don't need to do anything additional. Of course, we talk about the real safety factors are about space, face, good hand hygiene, and cough etiquette.
Exactly, because it's all around stopping those particles that could be coming out of my breath, could be coming out of your breath, and keeping away from them. They do tend to fall away to the ground fairly quickly. So those are the things that we really need to focus on, and I suppose try and get into a routine that we're all happy with. And it is really difficult for those impacted by cancer and trying to keep a normal family life going with school-going kids, college-going kids, all of those things. And it's quite difficult to explain, particularly to smaller children, around these challenges. But children are very adaptable as well. And I think when you explain to them and they understand, they're really very happy usually to help out, and particularly if they know that their parent or loved one is at risk. See,
living well is living well. And living well is in a way, we can't be overwhelmed by COVID. Our challenge now is to live with it. And that's our challenge, really, isn't it?
Absolutely. Finding ways, finding the joys in life, the positive things, and again, I defer to your knowledge on these things, but find the positive things in life, keeping an eye on the things, protecting ourselves, and engineering those into our lives.
And it's that balance, really, because it doesn't always have to be positive, because living with cancer and family members or carers, or whatever role that we have, so it's about having this balance in life, that it's not, I see it like a rear view mirror, right? Do we want the whole rear view mirror and we're looking into it and we can't see anything through the front? Or do we have to put it into a space that it's small, it's part of our lives, but it doesn't overwhelm us? You've seen this in your work in the Irish Cancer Foundation.
Absolutely, and I think that's what a lot of people are starting to transition to. I think we've had that shock over the last few months of trying to adapt to the uncertainty, all of the different reports, all of the different so-called experts, etc., talking about different aspects.
And the trials are back up and running. This is really critically important.
Trials are back up and running, and we need to try and encourage and foster those trials. And if you're interested in a trial, make sure and ask your doctor or maybe your liaison nurse. Let them know that you're interested. And all the hospitals around Ireland are back operations. Some of those trials have changed a little bit. But we are, and Ireland is an active space for research, because I think we benefit from that ourselves, but also people want to contribute so that maybe the people who come after them will also benefit.
And I want to thank you. I want to thank you on behalf of all the researchers. Quite often they're the hidden part of the team, but there's research going on, it's ongoing. You're a huge component in the chain of healing, and I want to thank you for that, Robert, you and the team.
Thank you very much, Eddie. Thank you.
That's all from the main stage now. Get over to the sessions tab where you'll see our 4 workshops for this morning. Incredible workshops, there's 4 of them there. You can pick and choose. Remember, you can hop in and out of the different workshops. The first one is Why Eating Well Matters with our oncology dietitians, really practical workshop. The second one is Understanding Your Inherited Cancer. The third one is HRT After Cancer. And the fourth one is Calming the Mind, the breathing space. It's a mindful practice and meditation. So really nice, tuned in, reflective workshop as well. Remember, they're all recorded and you can access them. Also, as following our workshops, there'll be a break and you can visit our exhibition or connect with one of your fellow attendees. So remember, the expo and the networking tabs in the Irish Cancer Society are going live in the expo to tell you about their advocacy network. The network invites anyone touched by cancer to join the Irish Cancer Society to ensure that many needs of cancer patients are communicated to the government. Advocacy support, reaching out. This is what the Irish Cancer Society do. Remember, I'm going to see you back here at 2 o'clock. Dr. Paul Dalton is going to join me, and we're going to look at tackling and managing fear, primary emotion. It gets really activated during the diagnosis and when cancer is identified. So we're going to explore that and look at some ways of managing that fear. Join us at 2 o'clock with Dr. Paul Dalton.